A hysterectomy is a surgical procedure to remove the uterus. There are numerous ways of doing a hysterectomy. Very often patients are a little bit confused about what happens with the ovaries with a hysterectomy. That oftentimes people feel that a total hysterectomy also means removing the ovaries along with the uterus, but the hysterectomy itself is only the uterus. And I think that's a common misconception, that if someone says they have to have a hysterectomy, the patients think that they're going to have their ovaries taken out and lose their hormones. Some of the reasons that women need hysterectomies are abnormal bleeding, also uterine fibroids, pain, endometriosis are some of the most common reasons for hysterectomy at this time. And probably right now, fibroids are the leading cause of the need for hysterectomy. The fibroids most often are diagnosed both on clinical, discussing with the patient, you get the understanding that most likely there are some fibroids causing some problems. And then looking at things such as the physical exam, feeling an enlarged uterus, ultrasound now plays a very major role in the diagnosis of fibroids. As far as abnormal bleeding, that's usually based on the patient's history, along again with ultrasound looking for the reason for why their bleeding may be abnormal. And now hysterectomy very often is more in bleeding that's not been responsive to less aggressive therapies which are now available for abnormal bleeding. Non-surgical treatments for uterine bleeding have really evolved over the last several years to increase the options that are available short of hysterectomy, including medical therapy. There are some both short outpatient or even office-based operative procedures such as endometrial ablation, which can be used to treat the abnormal bleeding, which has significantly decreased the number of hysterectomies being done just for bleeding. I think in looking at hysterectomy and looking at what type of hysterectomy we should do, starting off saying, can it be done vaginally? Because I think there definitely is the information to show that is probably the safest route. If the vaginal hysterectomy is unable to be performed, then looking at one of the laparoscopic approaches, whether it's the traditional laparoscopy or robotics, mainly based on the pathology that is going on. Robotics allows better visualization because of how the camera works with that, and also manipulation of the tissue, especially if someone has significant scar tissue. It may be easier to do that with the robot. With the minimally invasive approach, its main benefits are definitely to the patient for both less pain, shorter recovery, shorter hospital stay. Most all of the hysterectomies done minimally invasively are at most 1 night in the hospital. Patients are able to get back to work in 2 to 4 weeks as opposed to 6 to 8 weeks from a traditional hysterectomy. And the recovery as far as during those times having less need for pain medication. There's also less scarring and less recovery from the major incision. Patients who are undergoing hysterectomy, some of the most common questions definitely are the recovery time, how long they're going to be out of their normal activities, which I think is a major advantage to the minimally invasive approach to get them back sooner. Whether they need hormones or not is the next question, is the most common one, and that very much depends on why they're having the hysterectomy, what the indication is, as to whether or not the ovaries need to be taken out. Most of the information now shows that unless the ovaries are causing a problem, we should leave those in order to avoid the need for hormone replacement or the having to live without the hormones. I think when patients are looking for a hospital system to have a hysterectomy, I think Secours St. Francis would be a good option. The hospital system has gone through the requirements to become a center of excellence for minimally invasive gynecology, showing that a very large percentage of the hysterectomies done here are done laparoscopically or minimally invasively, both vaginally, laparoscopic, or with robotic assistance, and are very much well above the national average in that percentage. I think in looking at with the future of treatment for diseases that currently require hysterectomy, I think we're going to see some advances in incisions, being able to do these through one incision. You can do that with traditional laparoscopy right now. There's some work being done on that, and also with the aid of robotic assistance, changing that into one incision in the belly button and not the additional incisions, so they decrease the size or number of incisions. I think we're also seeing significant advances in the medications and other minimally invasive, even less invasive to whether they're outpatient or in-office procedures that are more quickly and with less need for recovery that are continuing to be advanced over the years to come.